Okay, I think enough. We've got enough, and the folks here that we wanted to make sure we're here. So what we're trying to do today is make sure we coordinate our efforts and also our information. About the vaccine, about getting the vaccine here. There's been some issues, and we'll talk about those. And but the important thing is that we're all on the same page with the same information. The public's very anxious, particularly folks that are, the older folks or people who are more vulnerable with health conditions and all are very, anxious to get this vaccine. And there's a lot of misinformation out there. And, the best way to clear that up is to communicate. So here's an opportunity to do that. So with that, only thing I ask is when we start talking a little bit and everybody's trying to have some input, it may sound silly in the electronic age, but if you wave your hand like that, I'll see you and I'll make sure that you get the floor. I'll moderate a little bit. There's nothing worse than on a conference call or these things to try to overpower the mic and get the microphone. So I give you I'll give you that commitment that I'll watch for that and can do that. So with that, the first thing we'll have is our council chair, Jason Steen, kind of give everybody some remarks and where his perspective on the situation. So Jason.
We thank everybody for coming to get together on a short notice. We know this is very important to everybody. We're hearing it from all angles. I know everybody's hearing it. When the vaccine, where the vaccine. A couple weeks ago we met with had a group meeting with our first responders because we didn't hear anything from anybody about how to get it, where to get it. And so it was important to us to come together as one voice. And we did that a couple weeks ago. And immediately, somebody was recognized and we decided to send a letter, to the hospitals and the governor. And immediately we kind of got a little response. But, the thing we did unified. And we're finding out our little county, we're getting left out on a lot of things. We don't have a hospital, and that is a problem. We know the reason we don't have a hospital, and but we have different agencies coming together, and you see different things on Facebook here or there. But we've got to come together as one group, one voice, and make sure that if anybody knows anything, that we'll have an avenue to get it to everybody. We have people literally dying, and that because they don't have the vaccine. And so it's important that we find an avenue that we can get together and make sure this happens. There's 3 funerals this week of close friends of mine we lost from the COVID, and so that's it's very important. And I know the state level, we hear some things with local from DHEC and this and that from local DHEC that the state level is not getting it to them, and if they're not going to do anything, I think we have to do something at our level. So we have to make sure we look after our citizens. And I just feel like we're getting scraps, as the says, because they're overlooking us. It took forever. They tell us to get our first responders for phase 1, and we didn't even know where the line was. We didn't know where to go, how to go, and so we have to be ready for the people for when this is available to the next one. And so that's the reason we're here today, is we have to get together. It ain't about none of us getting credit. We all come together as one, and that's what our citizens want, is to make sure that we get the right stuff out there. And if they can see we're unified and working, that's the only thing they care about. That's all they care about.
Okay. Thanks, Chairman Steen. I was going to give you an overview of kind of, y'all mute yourself if you've got a noisy background, please. I don't want to mute everybody, but I can. Kind of where we are and some of the struggles we've had so far. Somebody is still creating a big ruckus. I don't see the button to mute everybody. Okay, anyway, so where we are and the struggles we've had here recently, this thing started out, obviously last spring, and during that time there was a lot of work with, Steve Akers with emergency management, state emergency management folks, DHEC, all that. Steve can talk more about that in a second. They identified, providers, they call them, places where it could be administered. Our EMS department, I think, was either qualified or close to it. All that stuff was happening. Everything sounded good, getting ready and planning for this. And then it disappeared in the vapor. And for everything we can tell, this happened on the state level with DHEC. It just went away. And then one morning, Steve and I, about at the same time, were hit with the same lightning bolt where we realized nobody has contacted us about first responder vaccines. And we knew that they were out there and we had not heard a word. So the first thing we did was call a meeting of public safety officials in the county, also the mayors, and Chairman Steen was there, about that. And as Chairman Steen said, agreed to come together as one and try to push to get this. Well, as it turned out, what I think happened, or what I think has been proven to have happened, is all the vaccines went to the hospital systems in the state, which is sort of how DHEC works. Very powerful hospitals are very powerful, and there's a lot of politics in this. They all went to the hospitals. Now, the hospitals, in my opinion, from no fault of their own, looked at, didn't have a lot of guidelines passed down to them, and they administered these vaccines in the areas around their facilities, and we don't have a facility. So we met, and the group agreed to do two things: for me to write an email to MUSC and Scotland and McLeod, because there were South Carolina hospitals that had been involved here. And then secondly, write a letter to the governor expressing the concern. The letter to the governor was signed by the mayor and the chairman and the other mayors and everybody in the county. Councilman Odom was able to make some contact with someone in the governor's office, but to date, we have not received a response from the governor's office, even with a letter from all these high elected officials here. Very disappointing. The email to McLeod and MUSC was answered very promptly by the CEO, I can't remember his name, Vance Reynolds in Florence of MUSC, and Donna Isgett of McLeod. They answered very quickly. McLeod stepped up and said, we can take care of this, and put us in touch with, Steve, what's his name? Bren, or Sully and Shaw. Bren Lowe, is that right? Okay.
Yep, that's it. Bren Lowe.
And he was very helpful. And, but we were not able to get anyone to come here and do it. We had to send everybody elsewhere. And that was the case with, MUSC as well. So we started that process, and they ran out of vaccine. So everybody didn't get vaccinated. So then we kept pushing. And we've had, just so everyone knows, we've had pretty good working relationships with regional DHEC folks. The closer to the ground you get, there seems to be happening. The further away and the closer you get to Columbia, it ain't happening. So we were able to, work with them, the regional guy, and they brought some vaccine to the county last Friday, as you know, it's been in the paper and all. And so we were able to get those first responders, at least the ones that want to get it, inoculated. Of course, DHEC, unbeknownst to us, the day of the things let people over 70 in. So you had sort of a, it was crowded and a little bit difficult to manage, but that's DHEC managed the site. All we did was kind of press to get it here. We did. And they were able to give vaccinations to 210 people. Steve, isn't that right? Just nod.
That's correct. Yeah, that's correct.
Which was disappointing in itself, because we understood there to be 1,400 vaccinations, or the equivalent of it, for Lee and Marlboro County, and somehow that turned into 210 by the time it got here Friday. So needless to say, there's a lot of frustration on our level. There's a feeling that we're not getting any attention, and that's not just us. Lee County, other counties, there's like 8 or 9 counties that are struggling like this. And it seems to be a continuing pattern with state level agency management. We had the same issue with them not allowing us access to the database of positive cases for EMS responders. It's just been a difficult situation. So, so that's where we are now. And so what I think the best course for this meeting is to now let Steve Akers, our emergency management director, kind of bring us up to speed on what's happened here in recent history. And then we can talk among ourselves about what we can do. what resources we may have, you know, in the community to make sure we have a site, or we have, you know, medical people that can help, or whatever. And with the goal of the two-part goal, one is to get our people vaccinated. Well, that's the overall goal. In Marlboro County, that's the challenge. And to help anyone, any organization, or any qualified individual willing to work towards that goal, remove barriers to do that. And they are significant barriers. So with that, I'll turn it over to Steve. Steve, you're muted.
Yeah. You know, our frustration, as county administrator said, is that when we started this, we made plans, and we had a plan, a solid plan that we coordinated with the regional DHEC folks. And that plan, you know, led to our EMS being certified as a provider. And the plan was to have EMS actually provide vaccine to first responders and county employee, our government employees in the county. Now that was way back in, I think it was November, maybe as early as September. But, you know, all that occurred and we heard nothing back. So our frustration continued. And every time we would contact regional DHEC, it was always referred us to the state. They referred us to the state in Columbia, basically headquarters. But now what we've seen is, though, a transition where it looks like they're starting to let regional starting to do things again. And I've been on the phone last couple of days with the regional public health preparedness director out of Florence, and they're looking at naming sites and picking sites, selecting sites, whatever, to determine where they can actually deliver vaccine. Now, when that vaccine actually, when those clinics actually occur, we don't have dates yet, but I don't know if they're going to be by appointment or by walk-in. The problem with doing it by walk-in is that, you know, the state of South Carolina only gets 63,000 doses a week. Well, if you do the math on that, that'll take 79 weeks to do the first dose for everybody in the state of 5 million people. So until the frustration that we have here in this county is, we know we have nobody in this county that's receiving vaccine to stick in somebody's arm. And so we have to rely on outside sources to come in, like DHEC or whoever. And with the stream so small coming into the state, you know, if we could control, if it was like blankets or something like that, oh, we could do it in no time. But until the federal government increases the stream coming into the state of South Carolina, you know, this frustration is going to exist. But at least if we can get something going where, and it looks like DHEC is now starting to do that, to start, you know, sticking arms in one or two places in the county. And when those dates come out, of course, we will obviously provide them to the public. But I've got a strong feeling it's going to be by appointment, so they can actually determine how much vaccine they need to bring, instead of, you know, because imagine having 8,000 people showing up and you have 500 vials of vaccine. Who tells the 7,500 people that, you know, so it has to be planned, you know, down pretty tactically how they're going to do that. But that's basically where we stand. You know, we've offered all of any support that we can provide for DHEC or any provider that's willing to do the vaccinations. It's just that, you know, it's slow turning when you're dealing with DHEC.
Okay, and I think it bears repeating that, you know, Marlboro County government and local governments here, we don't have any control over this. You know, we're begging and pleading, as we seem to have to do frequently. And but we are offering up anything we can do to do this. It just needs to be clear this is all being controlled by DHEC and, you know, through the hospitals to some degree, but they're doing what DHEC, you know, what parameters DHEC, operating under parameters DHEC provides. Okay, so now I know there's a few of us that have some information to share over the last little bit, and I'll share mine first. And I'm going to try to keep a list here of action items that we can review near the end. I had a call and an email last night, about 7 or so. I had the email about 7, call earlier, from Greg Wood with Scotland Hospital. You know, that he's the CEO of Scotland, and he is asking for any help that we can provide politically to expedite his hospital being able to administer vaccines at their sites here in Marlboro County. They are unable to get approval from DHEC to give shots at Scotland facility here in the county. Now in North Carolina, it's a little bit different setup. It's a lot less politics in things in public health. They have county health departments that have a lot of autonomy and able to do things. So he's able there to get the health departments to say, yes, these folks are good. But here it all funnels back up. So that's something to put on the list is, how can we, and Representative Henegan's on here, how can we all get that done? Because obviously there are a lot of people that go there. So that's one. Jane Rogers was on here. Still there? Yeah, I see you. Jane had something she called me about. So unmute yourself there, Jane, and tell us about your part.
Okay, can you hear me?
Yeah.
I talked to MUSC, Joe McCall, and he just sent me a link, Ron, that I'm going to share. I'm going to send on to you. They are having a event in Florence on Monday, and their goal is to distribute, I can't remember how much, but hundreds of vaccines on Monday. And he said that once they have finished that event and have worked out the kinks or see what kind of kinks or problems are created from that event, then they will be able to roll that out to other communities. So, and that this event was created because they had so many people booked so far out that they were able to get some, they have the vaccine, they think, to handle a large number at the Civic Center on Monday. And the people that were scheduled in Florence as far out as into April, they're calling in to come in on Monday. Now this link that he just sent to me while Steve Akers was speaking, so I kind of missed part of what you said, Steve, is that the Florence event location for Monday will be live on this website at noon, I think today. He doesn't say, it just says at noon, for folks who want to register for a slot. So I'm going to send this link to Ron and let him get it out to everybody who's here. And then back to the other conversation about being a provider. If EMS is a provider, then we have people in the community who will volunteer their time to be an on-site provider. Dr. Nobles is willing to.
And if can you hear me okay? I mean, for what it's worth, I tried to contact DHEC. There was a article in the state paper that was called DHEC in Columbia. Of course, I called the number, and it went to the person's voicemail, and it said, the voicemail box is full. Can't accept any messages. So I sent them an email, and the email I got back was a link to another link to another link, and basically I never really heard anything from them. I think one thing about DHEC, though, they were really slashed pretty substantially 7 or 8 years ago, and so their mission has been made difficult because they really don't have personnel that they want to have. I think the problem in South Carolina is the fact that the governor used the hospitals to distribute the vaccine, and instead of using local pharmacies like they did in West Virginia, where they've had excellent distribution of the vaccine. And there's a substantial number of counties without a hospital. So, and I think we've all been sort of left in the lurch here by the hospitals that are supposedly serving this county. That obviously they haven't really done much, any of them. And candidly, I mean, Scotland, I think the state vaccine program is complicated, and I think they have really tried to get on the state vaccine program for a few years without much success. So there again, I think that was a political issue that was difficult to to fix. But I mean, as far as it goes, I'm willing to help out in any way that I can as a volunteer to help administer these vaccines. But how we can find someone to partner with that's going to actually be able to give us a supply to give. I don't think the local administration of it is the problem so much as the availability of the medicine to give.
And Ron, I will add too that I've had verified last night and this morning. I don't know if any of y'all have been on Facebook, but on the Scotland page, they've got numbers up for the health department and for the hospital to call in and get an appointment. And they will accept Marlboro County residents to go over to Laurinburg and get the vaccine. So I know people from here are on their schedule to go get the vaccine in Laurinburg. But as far as getting it administered here in Marlboro County, we've still got hurdles to cross.
Representative Henegan, were you raising your hand? Wait a minute, hold on, let me unmute you, hold on. There you go, go ahead.
Thank you so much. I had a chance to talk to Ann today with Care South. And one of the things that Ann mentioned to me that they were willing to administer the vaccine to other sites. However, DHEC would only allow them to be at their sites. They will be administering vaccines next week, and it's supposed to be up on their site in a few minutes, stating that they would. At first, they only was going to allow people who were had already signed in and not and first responders and all, but now they're willing to do anyone 70 and well, they were going to use only the people that were actually their patients, but now she told me that they have changed that anyone over 70 will be able to get the vaccine. Dr. Nobles is right when he said about the hospital and the governor. One of the things that I've been to see him and talk to Sims about was instead of just the hospitals, the pharmacies need to be able to get these vaccines, but I don't know where that's going at all. I also talked to him about student nurses, and I understand now we can use, the problem was in some of the areas that they could not get nurses, and a lot of them in certain areas were quarantined. So we asked him about student nurses and from the tech school as well as from the colleges. And so that has been approved now that we can do that. My concern is that after all of this, the problem is, to me, is going to be still the vaccine if we can get enough of it in the county. And that's a major problem for all of us.
Yeah, it is. It is. Also someone was telling me that some of the hospitals are hampered by the fact that everything they do goes through some sort of software system that each of them have their own software system.
That's exactly right.
You're
right.
Everything's jacked up because the filling out the paperwork is a huge obstacle. And, some directs, Representative Henegan, I'm gonna harp on DHEC. DHEC's got to step up and say, look, here's a common paper form, use this, to put people in a back room to do batch entry later on.
I agree.
Dr. Nobles is raising his hand, I think. You got to unmute yourself there.
There.
All right.
I think one thing about, particularly with the Pfizer vaccine, is that we probably don't have storage capacity here in the county for it, because it's the one that has to be stored, at minus 40 degrees. So the distribution on it, particularly, I think, is complex just from a logistic perspective, being able to move it around. And not only is the temperature sensitive, but apparently it's sensitive to vibration and motion too. But I think, the Moderna vaccine is the one that only has to be in pretty much a standard freezer. So I think that's another confounding factor. In the newer vaccines, the ones that are supposed to be coming out here in the next month or so, don't require that degree of refrigeration and carefulness as far as transportation is concerned.
You're so right. I talked to Care South and found out Moderna is the one that they will be using in all of the places where they have their site set up. It will be the Moderna vaccine. And just because of that reason that you mentioned, Dr. Noble.
Well, it just kind of, highlights something that in some internal discussion here is that everybody here has got something to offer of someone they are related, connected to, whether it's Care South or MUSC or McLeod, whoever, and we're all scrapping and scraping to get something here. And my huge concern is that there has to be leadership from DHEC controlling this stuff. We are begging for scraps off the table, and the only thing we're getting is because of our personal, professional or whatever networking with people. And so, there's two parts of this. One is how do we get it, however we get it, which is what we're talking about. Secondly, and Representative Henegan, you know better than we would know, how do we get the attention? How do we in the other rural counties in this same boat get the attention of DHEC and the governor, who, quite frankly, the fact the governor won't respond to a letter from 5 elected officials in the county, we feel like we're just beating our heads against the wall.
Ron.
I'm sorry.
Whoever, I think Representative Henegan had it first, Jane. I'll get you.
Okay. One of the things that I want you to know that we just recently, y'all and I got together to send a letter to them, because really, to be honest with you, DHEC needs to be split with the things that they're doing, because I think they're on overload right now. But so far, we have not heard back. And we also sent it to the federal level because we were very concerned about it.
Yeah, it's a timely matter, and it's moving at a snail's pace. And even for folks in urban areas close to major health centers, it's going slow. And so when you get out here in the boonies, and we're apparently insignificant, it's just very, very frustrating. So Jane Rogers.
Ron, you had mentioned earlier that EMS had been designated as a provider. Is that designation still standing? Can we use that designation to obtain vaccine for the county?
Steve, or I think Calvin, you're on. Y'all know anything about that?
We're still sitting in process.
So you're waiting on somebody to say yes.
Mm-hmm. We've done everything that we're supposed to do. We're sitting.
Yeah. So who was that? Sully, did you raise your hand?
Yes, sir.
Yeah. Okay.
Hey, just I spoke with Bryn Lowe, our administrator over at McLeod yesterday afternoon, and he informed me that McLeod was working to secure a location in Marlboro County, probably in Bennettsville, to set up a clinic to distribute and administer the vaccine. As we've all discussed, the challenge is availability. The doses that we received this week were utilized in one day. So it's just a matter of getting more vaccine here to us in the county. Time frame I can offer is we hope to have a place secured and up and running within a week, no more than 2 weeks. But I will keep you informed as I know more information.
Yeah, for folks that may see this later on, Sully Blair is on the board of McLeod Hospital. So what he's talking about is McLeod. So that's great news as well. And like I said, particularly Bren in Sherrall really helped us before. And as you say, he's limited by what he has. Sully and everybody else, if a location is an issue, that is something we can do. We use the city's community center, and Dr. Prince, I assume that's fine to do that again. So anyway, just keep that in mind, Sully. Please pass that along. That's something we can help with.
Will do. Thank you.
Any of you all. Dr. Prince, are you unmuted now? I'm committing the city. Is that all right? Max is not.
That's all right with me. Just let us know.
Okay.
No.
Yes, this is Max.
Hey,
this is
Max.
Max, Ron. Can I speak?
Yes, sir.
Yeah. Needless to say, the city will do all it can to provide and help with facilities, except for the storage issue. That's something someone else will have to take care of. But yes, there's community centers available whenever it's needed.
Well, we appreciate that. I think it worked fairly well the other day with what the DHEC thing that they put on. Yeah. Dr. Noble, that was good information you provided. we also talked about storage, with EMS and all, and we had understood that even the Pfizer can be out of the fridge for 5 hours. What is it, Calvin? Something like that.
Be refrigerated for 5 days and up to 15 days in the initial storage container, provided that it's re-dry iced.
So you broke up 5 days after it comes out of the super storage?
Right. 5 days it can be just refrigerated.
And I hadn't heard the thing, Dr. Nobles, about the motion part, the moving it around, but, we were kind of hearing, this, what Calvin said, we were, as we do, thinking that was just a smoke storm, to keep us from getting it. Anyway. Okay. Well, did anybody else have anything to offer that maybe, or, I didn't see your hand or?
Yeah, Ron, I'd like to say something.
Yeah. Hey, this Councilman Berto.
Ron, one thing we need to sort of keep up with, I did talk to Scotland County yesterday at the site, and they started yesterday to drive in. That is a drive-in site. People don't even have to get out of the car. And the other thing, and I talked with probably 5 people last night that had appointments this morning, we need to possibly get a running total at the end of the week from Scotland, maybe every Friday, so we know how many people from Marlboro County are going to Scotland County. And so we can have and we really need that from all the agencies, so we can have a good number of how good a success we're having with getting people vaccinated.
Yeah, that gets into HIPAA stuff, but it would be nice to know. I mean, even trying to track the first responders has proven difficult.
And back on the federal, coming from the federal level too, South Carolina's getting, I think, an average of like 28 doses per 1,000 people, whereas the national average, I believe, is 46. So I do know there's a letter to Senator Graham to see what he can do about getting more dosage coming down from the federal level into South Carolina.
It would be nice to know what, if you could, really what is the supply issue from the feds and what is the administration of it once it hits the state. I mean, I have to say that from watching it from afar, no matter how much they sent us, the state has really screwed up how they've done this. But those are both good points. Anybody?
That's it, Ron.
Okay. I'm trying to see anybody else. I have 2 pages of people here, so. With that, I was trying to come up with what we do as a group next, and the issues that were identified, the issues that we need some help with, I guess, one was the Scotland thing about getting those folks where they could give the vaccines here. I think that's an important one. Representative Henegan, I think we're gonna need your help with that because we can't even get anybody on the phone.
I'm going to call today. I wrote that down as a note. I'm going to call the governor's office in a few minutes.
Okay. And then continue. We need to try to get some response out of DHEC for Dr. Noble's volunteering and all too, while we're going after that, because just not getting a response isn't working. Really, that's the one thing, other than we can continue to complain. That's all I had written down for action. Did I miss something though? Yes, Jane. You got to unmute yourself, Jane. There you go.
What? Go again. Tell me again what you had for recap, because I'm.
Scotland trying to get to somebody at DHEC to tell them they can give doses here.
Right.
And the other one was to try to get somebody to actually consider or talk to Dr. Nobles instead of a voicemail, and the thing about this is the thing that we're fighting in everything we do here is that we're a small little county up in the corner of the state, and we're insignificant compared to other things. And if I were running DHEC, I'd be focusing on the bigger population centers. And so in a bigger population center, a semi-retired doctor volunteering to give shots would get over here on the back thing. In a county with no hospital and a very impoverished population, we need more than a voicemail on this. We need somebody to pay attention. And I don't know how to get to them. Representative Henegan, you have contacts. That is probably our best bet. Writing the governor, doesn't seem to work. So that was the second action item with the sermon attached, was to try to get somebody to talk to Dr. Nolan.
Well, and on I don't mean to jump ahead of him, but the third one too is to get EMS as an official provider so that the vaccine can come directly to us instead of having to wait for the hospital systems to have the availability to come to us.
Well, I would think that's a two-part thing. Steve, you might want to chime in. I think that, they'll approve all or none at some point, and that's probably looking at that. But then there's also that part that, to tack something else on for Representative Henegan while she's got him on the phone. We need some priority status because of the lack of a facility here.
Yes, yeah. So it's really 4 things then, right? Did I count that right?
Yeah, I'll try to clean all this up and send it out as an email, but yeah. I mean,
Thank you.
I think Calvin can correct me, but I think EMS is already has already been an approved provider. That's not the question. It says that we've just been sitting still, no further anything about, hey, we can send you 100 vials or whatever. Is that correct, Calvin? We have been approved already.
That's correct.
Okay, so we just need the vaccine.
Exactly.
Gotcha. Okay.
well, and you go on the website, Jane Rogers, somebody showed me, and DHEC's got public pharmacies where they're going to be a provider. That is unacceptable. We're sitting here dying on the vine.
It's Publix and Kroger and Harris Teeter.
That's right.
I saw Harris Teeter this morning.
If
But
that
we can't get
something
any
to be upset about, I don't know what it is. Then that is a real case, snapshot of the issue we're facing here. I mean,
I think that comes from, somebody's taking initiative to go after them, to tell them you're able to do it. And, I think Sully, he said that, McLeod's willing to do it. They're trying to provide a site. Jane said MUSC's got a site in Florence that if that works well, they'll go here. Care South has something, but I think we've got to work hard, and, we're going to, this is where Representative Henegan can really help us out and has to help us out, to get DHEC, get them on board, push them, and, being there every day. I mean, for this is to get that unified voice like we talked about before, how many doses, because, every other hospital that we talked about is in another county, their main hospitals in another county. So we're going to have to get what's left over. It just seems like, and it's not from the hospital, it's just from DHEC. So, if, hospitals can only do what they can do. So Representative Henegan, we're going to be bending on your ear pretty hard. And, we send a letter and we can't get a response. Anybody usually responds to something. So you're the only one that is there all the time. So we are going to.
Who did you send it to? Who did you send that letter to?
Governor.
Send it to the governor.
Yeah. Thank you. Okay.
Yeah.
Okay.
So, the big thing is just get a response, and when you don't get a response, it's like, we don't even matter at all. So what is that saying for our citizens? It says to your elected officials that your citizens don't matter, and so we have to get a response from somebody, or this meeting and all this time is wasted. So that was our whole point of getting it. So we can get some answers from someone.
And I'd like to add, Representative Henegan, you were copied on the letter that we sent to the governor, you and the other members of our legislative delegation.
Okay. I wasn't aware that they didn't respond. And that's why I was asking that.
But you did get our letter.
Yes. I just wanted to know who else it may have gone to.
Okay, well, I think
I have one
Yes,
more
ma'am.
thing. This is a major problem, but one other problem that we're having is the fact that many of these elderly over 70 cannot go online to fill out that form. And I'm getting many calls about that, trying to go online to fill out the application. That is that's a hindrance within itself.
Well, that's a great point, and that's the kind of thing that's going to take leadership from the DHEC governor's office, because this is in my mind, this is like a hurricane response or a military operation. If somebody's got to step up, take the lead and say, okay, we're going to create a common form, and the form is going to be used, and somebody later on can key it into a computer system. Because we can find people. You don't have to have an RN or be able to stick somebody with a shot to fill out a form. We can find volunteers or pay people to help these elderly folks fill out this paperwork.
Right.
We are, you know, I came out of manufacturing, and the whole thing is to make the process, you know, real efficient to get to an outcome. Well, in government, I'm learning as I get beat into being a bureaucrat, is everybody's obsessed with the process more than they are what you're trying to do.
Exactly.
And so, you know, far be it that anyone asking you, Representative Henegan, to change DHEC. I mean, I think that you all as a body are going to have to change DHEC.
That's exactly. I have a meeting with a group on Tuesday to discuss this vaccine again. So I'm going to make sure that I include them on the things that you're going to send me in just a few minutes, so that we can also talk about it together.
In addition to the being able to fill out requests for registration online, keep in mind transportation is also a very critical issue. Even I don't want to try to go to Florence and stand in line all day, or be in the car for 2 or 3 hours. So I'm going to take my chances and get it here in the county. So we would appreciate your help, Ms. Henegan. And
Here, okay.
And Mr. Malloy also. Thank you.
Okay, I'm going to talk to him in just a few minutes about all these things. As soon as Ron going to get me the 4 or 5 things that he wants me to address. And I know he'll do that very shortly.
Well, I'll try.
I know you will.
But it's, yeah, okay. Anybody else have anything to add?
Yeah, I was just going to tell you that.
For this meeting.
Yes, ma'am.
There is,
Steve, I see you. Go ahead.
if you go to DHEC's website, there's a Vax locator on there, and you click on Vax locator, and it will, you'll see a map, okay? And that map will have green sites, green squares, and red squares.
Right.
The red squares means that they're all full, but the green sites, if you click on it, it will come up with the site's name and a phone number you can call without having to fill out the paperwork. And the one thing that I don't understand, and Ms. Henegan, hopefully you can maybe push somebody up there in Columbia, why didn't they just do a mass mail out of the form to everybody in the state of South Carolina? And then if they don't want to go, they can throw the form away, but then they can fill it out, walk up and just hand it to somebody. Why is that so difficult?
You have a great point there. But one of the things that I do want to point out to you, that many of these, that form is not working. I can tell you that, you know, and many people are going up there and trying to, and having to pick up the form at that particular time, fill it out. It's really a major hindrance to many people going and getting the shot. Also, I don't know if you all are aware that DHEC is doing something today in Chester. I think it's today in Chesterfield. I think it's YMCA. I just got a call on it, and I couldn't get it all the way through because it went out. But I think it's today that they're going to be trying to do something there also. So just in case some people can go, that would be great.
Does someone else have something? I thought, yes, Wes Park, you're muted, Wes.
I've got a question. I've heard 65 and I've heard 70 as far as age and access to the vaccine. Which one is it? Because I know when I saw the form come through, it made reference to 65 years of age.
70 is what they're telling us, and 70 is what many of them have online already.
Shane.
It's 65 if you go up to Laurinburg to Scotland, because the rule in North Carolina is 65. So it depends on where you go.
Somebody was trying to talk. Who was that?
That was me. I was just going to say the same thing that Jane did, that North Carolina's lowered it to 65.
Yeah, North Carolina's 2 weeks ahead of us, maybe. You know, and again, not preaching a final sermon, but you'll find in North Carolina that things like this are much less politicized. You know, public health is not something that needs to be politicized, and so they're able to be a little more effective with these things. So, you know, I know the reform of DHEC is something on the legislative, a lot of legislators' minds, and I think it's it's time. But anyway, we need to just make it through what we're doing now and trust that they'll do that.
So how would we make contact with Scotland, or can we do that as a South Carolina resident?
Ron.
Yeah, I see you, Vern. Go ahead.
Wes, that I've got that number. It's 910-291-7654. And the young lady that was talking with me yesterday explaining the program's name is Emily. But what they will do, she will hand you off if you call to a scheduler who will call you within 1 to 2 days, and then they will schedule you for a vaccination within 1 to 2 days. And it is a drive-in. You do not have to get out of your car.
Okay, thank you.
Jane?
I would just add too, for the record, that those numbers are posted on the Scotland Facebook page. And so there's not only is there a number for the hospital, but there's also numbers for the Scotland Health Department.
Mm-hmm.
So they're two different locations, but the hospital is the newer number, the newer access. And yes, we've had people call this morning and say they were going to get a call back in 2 business days or 3 business days. So hopefully they have enough to go around.
I think the thing is, anybody get any information, that's the first. I mean, I guess I'm on Facebook some, but not a whole lot. But a lot of people is not. So I think we still need a avenue of travel to anybody get any information to send it to some group. I mean, it could be this group. I mean, if it's the administrator, he could get it out to everybody, then it blast out. I think we got to have a way to blast things for whatever information is, like Sully said earlier, he should have a location, but once it comes out, if everybody don't hear from somebody, I think we got to have an avenue to get it out. I think that's very important, as soon as possible for any group. I mean, so I think that would be a way or a start or a waypoint, at least, that we could start with, to say, if anybody hears anything, we're going to have an email to somebody and we respond through an email. I don't know how, but I think we've got to get all the information out as fast and as efficient as possible.
Well, the county council had, real concern about being able to disseminate information, and we're doing a newsletter that'll go to every house in the county. And we're talking about expediting that. It was going to start in March, but that's paper and mailed. But that, along with the newspaper and social media, might help. We do have the ability to do blast things from 911, but Steve, I think I can speak for you in saying we don't want to make it where folks don't pay attention to that when we really do have, a tornado or something like that. But that's something, at least on the county level, we can look at the staff level, and we work well with the city, and they have a cable access channel. We can meet with them as well, Mr. Chairman, and try to work on something there. I agree with you. You shouldn't have to depend on social media. It has, honest to goodness, turned into nothing but a way to make you have a bad mood. And we've got to get away from that. Jane, you've had your hand up.
Well, I remember that the information about the vaccines at Scotland is in the Marlboro Herald this week. It went out yesterday. We'll get it in the mail today, but I saw it online last night. So all those phone numbers are in the article in the Herald.
Okay. Anybody else? Okay. Well, appreciate everyone getting on. It was a little short notice. Mayor Petrone, I called you first because you got on me last time about giving you short notice. So you had the first call. Oh, you must not hear me. But I appreciate everybody making an effort to get on here. Representative Henegan, I see you're in your car. Appreciate that. I know you're moving around. So we can have more of these meetings, as things develop. So maybe next week we'll have a follow-up at some time, and certainly some email traffic. But I do appreciate everybody being here, and let's all work together to try to get us back on the map and get these rural counties some attention in a very desperate time for our citizens. Thank you. Thank y'all.
Thank you, Ron.
Thank you.